Today we're going to be focusing on female menopause and male climacteric. Looking at female menopause, now, this is an event that occurs in every woman's life when she stops menstruating and can no longer bear children. So this is for female bodies. The time of occurrence, the median age is around 51, but it does have an age range from 36 to 55. Climacteric is the time span ranging from 2 to 5 years during which a female's body undergoes physiological changes that bring on menopause. Now, early menopause is something that you've been seeing a lot in the news lately, and different research reports have looking at it. And some of the common causes include premature ovarian failure, or POF, having a hysterectomy, because often they'll remove the ovaries, and that creates havoc with the female's hormonal system, and then stress. Some of the symptoms of the beginning of menopause. Now, the majority of females undergo menopause, and they encounter few, if any, disturbing symptoms. But those symptoms may include hot flashes, which involves a feeling of warmth over the upper part of the body, usually accompanied by perspiring, reddening, and sometimes dizziness. This appears to be due to a malfunction of temperature control mechanisms in the hypothalamus. Estrogen deficiency contributes to this malfunction, and estrogen replacement therapy provides relief for the discomfort associated with hot flashes. Other changes that may take place during this time: the hair on the scalp and external genitalia may become thinner. The labia may lose their firmness. The breasts may lose some of their firmness and become smaller. There is a tendency to gain weight, although some females may lose weight. The growth of hair on the upper lip and at the corners of the mouth may appear, and headaches and insomnia may also be experienced during this time. Some psychological reactions to female menopause. So some reactions to the life event often depend upon the individual's interpretation for this life change. If an individual sees menopause as simply being one of the many life changes that one goes through, they're not apt to have any adverse difficulties. She may even view it as being a positive event, for she no longer has to bother with menstruation or worry about getting pregnant. However, if an individual views menopause negatively, she is apt to develop such emotions as anxiety, depression, feelings of low self-worth, and lack of fulfillment. Some women view menopause as a signal that they are losing their physical attractiveness. Now, there's no clear-cut way to determine the exact time when menopause ends. Most authorities agree that the climacteric can be considered as ending when there has been no menstrual period for 1 year, and physical symptoms of menopause usually end when ovulation ceases. Some doctors urge that some type of birth control be continued for 2 years after the last period in order to prevent any surprise pregnancy. Now, there are some fascinating ethnic and cultural differences in women's experience of menopause. Locke in 1991 found that fewer than 20% of Japanese women ever had a hot flash. So, whether this is due to diet or anything psychological, we don't know. Chornesky in 1998 notes that Mayan women in Mexico do not report having any symptoms related to menopause. Chornesky also reported that symptoms of menopause are uncommon among Native American women, our indigenous people, our First Nations people. Interestingly, in Native American cultures, menopause is viewed as an important rite of passage, signifying entrance into the highly respected state of elderhood and opening up the opportunity to assume important new social roles. So imagine if in general, that was kind of the belief system and the understanding and the reverence given to menopause for all of our people in the United States. How things might be different. Now let's look at male climacteric, or andropause. All right, so it's also known as the midlife crisis. So what is it? Now, this generally refers to a time when a male reevaluates his marriage and his family life. It's a period of change, ranging from 35 to 60 years old, and is often coupled with a significant decline in testosterone levels. A male going through male climacteric usually encounters some event that forces him to examine who he is and what he wants out of life. Launching last children, being laid off from work, the death of parents, his partner has an affair, all kinds of different things. Some of the common midlife crisis questions men ask themselves include, is what I'm doing with my life really satisfying and meaningful? Would I be better off if I had pursued a different vocation or career? Do I really want to be married to my wife or my partner? Now, this period of lowered T, which is testosterone, and self-assessment is often characterized by nervousness, decrease in sexual activity, depression, decreased memory and concentration, decreased sexual interests, fatigue, sleep disturbances, irritability, loss of interest or self-confidence, indecisiveness, numbing and tingling, fear of impending danger, and or excitability. All right, so the changing levels of testosterone in a male's body has significant effects on his psychological health and physiological sensations and well-being. Male climacteric is caused by a combination of biological and psychological factors. A significant part of the midlife crisis is due to depression, which is often brought on when a man fears aging and recognizes that his physical and sexual powers are waning. Depression at this time may be severe to the extent that suicide may be considered. A man at midlife is apt to experience a growing dissatisfaction with his job. He feels a sense of entrapment as the pressure to pay bills forces him to continue working at a job that he may find increasingly boring or unfulfilling. And the emphasis may shift from measuring success in terms of achievement to measuring it in terms of economic security. So in summary about the male climacteric and the declining testosterone levels, there's a continued capacity to reproduce. All right, so all male bodies can reproduce. They have viable sperm all the way up until death. The midlife reevaluation is really what the midlife crisis is all about.